Andrew, thank you so much for joining me for a short discussion about prevention, Prenuvo, and where are we going with healthcare sustainability by basically investing in health, not just providing sick care. First of all, I think in the eyes of many people, they kind of learned about Prenuvo after the post by Kim Kardashian.
Correct.
So you invested a lot into just providing influencers and well-known people with free scans, so they could just test them out and give you a free review. Can you talk us through a bit about how that looked like, what impact that had on the company?
Yeah, sure. Well, thanks for talking to me. We, in some ways, have a very old-fashioned strategy as a business. So we just want to provide a tremendously good clinical experience and in-clinic experience for our customers. And the goal here is if you have a great experience, then you'll tell friends, family, colleagues, and so on, and we will grow our impact as a result. What we found when we opened our first clinic in Los Angeles, all of a sudden there were folks that were coming in that had really, really big audiences. And no one has a bigger audience than the Kardashians. Mm-hmm. We're really excited when folks like this are, themselves interested in sharing with their audiences their experience of the scan. And it's had a huge impact. Thousands of people have come in as a result of some of the posts that folks have made, and we've saved hundreds of lives. Mm-hmm. So the impact has been huge for us as a business, but more importantly for the folks that have learned about us for the first time and then taken advantage of the service.
Mm-hmm. So how do you track who actually was impacted and had something discovered with the scans? I think it's 3 to 4% of people that come in to get a scan have something discovered.
Yeah, about 4% of people have what we call a potentially life-saving diagnosis. And this could be cancer that we typically catch at stage 1, various types of aneurysms, so cerebral aneurysms or aortic aneurysms or abdominal aneurysms. And then about another 10 or 15% of people have findings that require medical attention. They may not be life-threatening in that moment, but they could develop into something that's chronic and life-threatening down the track. Mm-hmm. And then 85% odd of people get a more or less clean bill of health. And that for them is tremendous peace of mind.
Mm-hmm. Yeah, we can maybe talk about that a little bit more. It's definitely very scary if you have some pain, and I think with the rising incidence of cancer, we very quickly think that every pain is cancer by itself. So what additional maybe experiences did you have with that or feedback from the customers?
Well, I think there's a few things to bear in mind about pain, and I would probably make 3 points. First of all, lots of cancer can grow to be quite advanced without any symptoms whatsoever. And probably the classic case of this would be pancreatic cancer, which is now the 4th leading cause of death from cancer. And typically symptoms don't present until the cancer has arrived at a stage where you really can't operate on, there's not a lot you can do. The second thing I would say is there's a lot of pain that we feel it, but either we ignore it or the health system ignores it. And a good example of this is ovarian cancer, where a lot of women are used to feeling pain in their abdomen and they might ignore it. And they eventually, when they feel that it's unusual, they might go to the health system and their doctors ignore it. And then the third thing is there's something called referential pain. And this is where our sort of pain shows up in places different to where the actual underlying disease condition is. And a good example of this is gallbladder cancer. Gallbladder cancer most often presents as shoulder pain. And so what these scans teach us is you may or may not have symptoms. If you have symptoms, they might be ignored. The symptoms you feel might be disconnected from the disease. So really the screening cuts through all of that and just looks inside and catalogs everything that we find.
As you mentioned, basically by bringing in influencers, you are creating a public awareness campaign for self-care. But at the same time, if we try to clarify what these scans are good for and when maybe they're not the best approach, how would you define basically who is eligible or for who it makes sense to do preventative MRIs? Because as we know, there's a lot of skepticism in the medical community about to which extent these things make sense if you're a healthy person.
For sure. So I would start by saying this is not the best scan for everything. What we believe is if you were to do one scan this is the most comprehensive coverage that you can get in a single exam. So for example, we will catch colon cancer at stage 1, but we won't catch it at early, or we won't see the polyps that you see from a colonoscopy. The same with breast cancer. We're very good at seeing through dense breasts, but mammogram can see can see the early calcification, and that's considered stage 0 of breast cancer. So these are what we do is complementary to standard of care screening, and so we always recommend that patients do what is standard of care, and in addition to Prenuvo, also do perhaps some additional cardiac imaging, because the heart is one area that we don't see very well, at least at the moment, because your heart is always beating and you're always breathing, so it can be very complicated and difficult and time consuming to collect great images of the heart using MRI.
You're not the only player in the MRI space. There's companies that are trying to decrease the time that it takes to do a whole body MRI. So instead of taking an hour or even more, it would take 15 minutes. So how do you see the field or the sector developing in this sense? And how do you also see the skepticism again from the medical community? Because the standard of care is still to take several minutes for a very small piece of the body when MRI scans are done.
Yeah, it's a great question, and the answer to both is kind of the same, which is what a lot of people don't appreciate is that MRI imaging is a qualitative imaging modality. What do I mean by qualitative? It means that the hardware that you use, the software acquisition protocols, the radiologist training, increasingly use AI, all of these combine to increase the medical accuracy of the imaging that you're taking. So the best analogy might be smartphone cameras. I had a Nokia phone back in the 90s that took photos, but the quality of those photos are very different to what I get from my iPhone 15 today. And so a lot of the impressions that physicians have about this imaging may well be based on technology that is 20 years old. And similarly, for consumers, it's sometimes very difficult to understand, well, how do these different companies compare? How do I compare Prenuvo to someone else? All I can say is this is the only thing that we do. It's not a side business. It's not an additional thing. We're 100% focused on making sure that we have the best hardware, best software, best AI, and best radiologists, so that these exams are as accurate as they can be.
Your positioning is as a preventative care. The biggest challenge is obviously the cost. The price of the scan is currently $2,500 US, which is a lot. I know that you are working on decreasing that price. So how do you see those efforts are coming along? We know that genomic testing went from $1 million for a genome to a few hundred
now,
or $100. Also, if you look at pharmacogenomic testing, it's around $1K or a few $100 if you want to do it, and even that is too expensive to be routinely included into health insurance coverage as a scanning mechanisms. So how are your basically efforts going into the decreation of price, and how do you see this challenge with what insurance companies or healthcare is willing to pay for to make something a screening option?
Yeah, I think there are two thoughts I have on this. The first is absolutely we're working to bring the cost down. Before we made this scan available to the public, a similar exam would cost around $50,000 to $100,000, at least in the US. So already we're a lot cheaper, and our goal is to bring it down to hundreds of dollars. And we do that through scale. We do that through speeding up the image acquisition time, as you mentioned, and then we do this through AI, helping to make radiology more productive, because radiologists are the most expensive cost. But secondly, I think the philosophy I have here is this is a very different approach to healthcare. We look at the entire body, and we're screening every organ in the body for maybe $15, $20. So I can screen you for pancreatic cancer for $20, for lung cancer for $20, for ovarian cancer for $20, for kidney cancer for $20. So we go through the entire body. Although the cost may, in the aggregate may be a large number, the coverage is also very, very big. And I fundamentally believe that in the US now we spend about $15,000 per person on healthcare every year. If we were to spend that amount of money at scale, hundreds of dollars, to do this screening, we would save orders of magnitude more in healthcare costs that are being spent right now on late stage disease and reactive medicine.
When a person gets a scan, and if it's positive, that's basically a beginning of the journey. Can you talk about how basically do patients that have something discovered present this to clinicians? Because this is an out-of-pocket expense, and even in healthcare, clinicians sometimes like to duplicate scans if they're done in another institution, even if that's a medical institution. So I imagine that here doctors might be even more reluctant to rely on the test if patients come with your result.
Yeah, it's also a really great question, and I know less about I have less direct experience in Europe, but I can say in the US what you described is absolutely true. And I think that's one of the other ways in which these scans maybe challenge the way that we're doing medicine. We see lots of things inside the body which we consider to be benign. For example, we see a lot of lesions, cysts, hemangiomas, and these are benign things. We want to check to see that they don't complicate over the years, but they're nothing that someone should worry about. In the US healthcare system, where there's a lot of medical litigation, oftentimes those benign findings would be subject to a whole bunch of intensive testing. Our goal really, and we counsel patients a lot when we give them the results, this is benign, don't do anything about it, we'll check it again in a year or two. So we're sort of taking this watchful waiting approach and hopefully using that to avoid a lot of these unnecessary tests that are currently happening today.
Which markets are you currently present at?
We're in North America, so Canada and the US, and we're opening in London later this year, and also we'll be opening in mainland Europe early next year.
What are your expectations of the European market? We're here at Health Europe, where we're basically discussing how different healthcare systems compare, and cultures also have different attitudes towards how much they're willing to spend for healthcare. New York Times said that MRI scans like these are a status symbol, so obviously you are also going to have a wealthier population that's going to be willing to pay for this. So how are you thinking in terms of the business strategy for Europe?
Well, I think, by the way, we have more things in common than we have differences. Like, everyone wants to live a longer and healthier life, and that's true for Europeans just like it is true for Americans. And I think now, particularly coming out of COVID, people are much more focused on looking after themselves. And we see this in people doing more exercise or investing in organic foods and so on. And in some ways, doing a Prenuvo scan is similar to those activities. It's about making sure that you don't get sick in the first place. I have a lot of hope that this is going to be a really big market for the company. And because a lot of the healthcare system challenges are the same in the US as they are in Europe, I expect that we'll have a similar impact as well on healthcare.
Who do you see as your biggest competitor in the space?
I mean, at the end, this might sound flippant, but at the end of the day, I think our biggest competitor is just lack of awareness that this technology exists. So, we're on a bit of a crusade right now, and that's why you see us leaning into working with influencers and people with large audiences, because people don't know that this category of service exists, and the more people that know about it, the more lives will be saved.
Okay. And do you also offer any counseling, even before people take the scans? I'm kind of going back to the thinking that when you raise the awareness, whenever people are going to feel unwell, they're going to be like, I'm going to get all the answers by getting an MRI, which is not necessarily the case.
Well, if I'm being honest, we survey everyone that comes in to get a scan, and we ask them at the outset, what's your level of anxiety about health? And 3 out of 10 people consider themselves very anxious about their healthcare. We survey people after the scan. In fact, several months after the scan, we send out a survey and say, okay, how anxious do you feel about your healthcare now? And universally, that level of anxiety drops. And for every one person that we might make feel, in their eyes, more unnecessarily anxious, maybe because we tell them about something that they may not feel like they could do something about, we are curing anxiety in about 30 people. So we are actually in the business of reducing anxiety as a company, not creating it.
The space of preventative health and diagnostics is very big. So I just want to, pick your brain on how do you see this developing. For example, we see whole body scans that are not based on MRIs. I'm referring to Neko Health, which they have their completely own technology. Then there's liquid biopsies, which are still in very early stages. But the hope of the companies developing these solutions is that this would be just a regular blood test that the doctor would order at an annual checkup.
Yeah.
And I guess the one thing to mention is that when we're talking about liquid biopsies, because it's based on DNA, they might even detect changes in proteins, cancer, and detect cancer even before it's visible on an MRI scan, because for an imaging test, it has to be quite big already that you detect it. So how do you see the whole landscape of prevention health and everything that's happening in the field?
I mean, I'm really excited about it. There's tons of innovation, and I think that there's not going to be one solution that solves everything. I think it's a combination of these sort of innovative approaches that are going to help provide us with tools that we can all better manage our health, and a health system can more focus on proactive medicine than reactive medicine. I think that's great. I'm really bullish about all these technologies. I think liquid biopsy is and will continue to become more and more accurate. I think the work that we're doing in screening, I mean, there's such tremendous innovation in the field of MRI sort of physics right now that we're going to be able to diagnose more and more diseases in the coming years. And I think there's a lot of room for new imaging modalities like what Neko is sort of working on. So yeah, I'm really excited. It's a really great time to be working in preventive health.
I mentioned earlier that some part of the clinical community is a bit hesitant about solutions like yours. So what's your business strategy for all the entrepreneurs working in the preventative health space to kind of change the opinion of clinicians, or just to basically educate them as well, or upskill them, which is a huge challenge in digital health, basically changing the awareness and knowledge about new technologies?
Well, I think one piece of advice I'd have for all entrepreneurs is a lot of people think of different channels as being sort of choices. So you can go after consumer, or you could go after physicians, or you can go after enterprise. I think with very transformative new healthcare, you almost always have to start with consumer, because consumers are interested and are early adopters, and it's through success with consumers that it sort of makes it possible to then go after some of these other channels that may be more valuable for a company's growth in the long term. So I wouldn't listen perhaps to investors that say don't do this, do this, and realize that building awareness is a journey. It almost always starts with consumers and probably almost always ends up with health systems. But you can't go straight to health systems if you haven't passed through the other stages.
You're a serial entrepreneur, so you built other companies before Prenuvo. What's different now? Like, how do your challenges differ now? Anything to share in that regard?
To be honest, all of my companies have been different, and they only have one thing in common, which is I always end up doing things that a lot of people don't believe in at the beginning. I am somehow attracted to these types of opportunities. So my first company was a first iPhone mobile company when no one believed in the iPhone and thought that it would be killed by Nokia. When we first started Prenuvo, there were a lot more physicians. I mean, there still are physicians today that question these exams, but back then it was almost universal. And I really am excited challenging these the conventional wisdom. And I think it's if there's no resistance to an idea as an entrepreneur, then probably it's not a very good idea, because someone will have already done it. It's that resistance that tells you that you're working on something that could be potentially transformative. And in the 5 years since we started the company, we're now starting to see that yes, what we are doing is in fact really quite unique and special.